The patient that I kept on coming back to is Dr. Z. Why Dr. Z? She was such a complex case, and when I started taking care of her, I was still relatively new to the role as a dementia care specialist. And there were a few mistakes that I made that I could have done better, but as a whole, Dr. Z taught me so much about how complex this disease was. I also wanted to highlight some of her psychosocial history and how that complexity, how that was impacted by the dementia and also vice versa. So Dr. Z is a 76-year-old female. She was diagnosed with late onset Alzheimer's disease the year before. She actually lives at home, and she is the primary caregiver for her husband, who also has dementia. She was referred to the ADC program by her geriatrician a year prior, but she never followed up with the appointment, and her family never actually even knew about the referral. And so by the time she was re-referred to the ADC program, it was because the family and her husband was in crisis. So as it turns out, her husband had a fall at home. He broke his hip, he had surgery, and he was discharged to rehab. I was called in for the crisis because of some of the behavioral problems that Dr. Z was having in rehab. So as he was admitted for care, Dr. Z was actually preventing the staff from taking care of her husband. She refused care, she refused for the nursing staff to give her husband medications, she refused physical therapy, and she really wanted to provide all of this care by herself, but obviously she could not. When the staff tried to help her, she became abusive towards her husband, but also verbally abusive towards the staff, and she was actually threatening the staff. At one point, Dr. Z took her car, and the title of this slide is that you can't make this up, because it's true. She took her car and she blocked the entrance into the facility with her car when they tried to take him out for an appointment. And I think the last straw was, again, you cannot make this up. Dr. Z came into the facility. She dressed up her husband in a suit, in his lab coat. She put on a stethoscope and his badge. And she found a wheelchair somewhere. I think she probably stole it. But she put him in the wheelchair, and she was going to take him out of the facility. She told all of the staff that he was a staff member there and he was leaving. And so at that point, it really was at a crisis because the facility had to call the police for taking her husband. So at that point, for her husband, the discharge options, because the team was so worried about his safety, the options that they gave the wife was to go home with 24/7 caregivers, or placement for her husband or both of them in a facility. And again, keeping in mind that they were living independently, neither option was acceptable to Dr. Z. And that's when I came in. So at that point, I actually scheduled a meeting with the interdisciplinary team, everybody in rehab. And I also asked her daughter and her son, Philip. Luckily, he flew into town, and they were all there that day. And we had a pretty meaningful and detailed conversation on where they wanted their care to go. So it was a goals of care discussion. And yet at the end of that meeting, bottom line, Dr. Z wanted to stay home. She wanted to stay home with her husband, and so she was finally agreeable to hire caregivers for her household. We were very fortunate that they had adequate finances, but that was the outcome of that situation, and so he went home. So technically, at that point, Dr. Z wasn't my patient yet. I just met them. They came in for the initial consultation to establish care with me roughly within that month. She came in with her daughter, Nicole, and her son, Philip, who was still there. As far as her medical history, she didn't really have very much. She was 76, but still pretty healthy, a little hypertensive, high cholesterol, and she didn't have polypharmacy. She was actually on very few medications. As far as her MRI, again, the findings were nonspecific, unremarkable, no evidence of any ischemia. Her labs also at that time were normal. Neurological exam, Dr. Z presented to our clinic very, very well. She was alert, she was oriented, extremely pleasant, very formal. She came dressed in a suit, properly groomed, happy, except she had no idea why she was there for the consultation. On the day of the consultation, her mini mental was 25 out of 30. Now, again, she didn't do too bad. What was concerning to me is that she missed the immediate recall, which, as many of you know, it's you tell the patient 3 words and then you ask for them to repeat it, and then try to ask them again a minute later to see if they remembered any of those words. And frankly, I was surprised. I was surprised that she missed it, but that was significant to me, as well as her family. Her MOCA test, she did a little bit more poorly on this one. She got a 22 out of 30. It was at this point during the visit where she started to realize that she was missing out on a lot of these questions. And so she started to become irritable and a little bit agitated towards me for asking her all of these questions. Prior to coming to the ADC appointments, all caregivers are required to complete some paperwork for the patient. And so, according to her family, she was still, completely independent with her ADLs. And that wasn't surprising. She was still highly functioning. As far as her IADLs, she was also independent in doing this. Again, knowing that she had been doing this, they were living independently prior to me getting involved in their care. At this point in time, the family started to kind of look at each other awkwardly, and they were saying, well, Michelle, Mom has been doing these things, but really, there's been a lot of things that we've been noticing that have been kind of strange and really unusual. I'm hoping that you can explain it to us. So they did tell me that Dr. Z, she was managing medications for herself and her husband. They weren't exactly sure about how those medications were being taken. Driving, as we all know, she was still driving, but she did report getting lost a couple of times as she was visiting her husband in rehab. Managing finances. She had been doing that their whole marriage, and this is something that had been unchanged. What did change in her behaviors is that she failed to pay a couple of her bills. Now, this is highly unusual for her because she was always somebody who was very responsible for managing their finances, and she missed a couple of payments. Cooking and shopping, she was also responsible for that. We found out over time that her husband had been losing weight, and this is something that we couldn't explain. We were in the process, we were about to get him worked up for weight loss, but we decided to hold off on that until we started, not behavioral modifications with Dr. Z.